Hi everyone, and welcome back to Dr. Curnew's YouTube channel. In this video, the Medications Club will discuss what to know about vitamin D toxicity. Let's start from the beginning. What is vitamin D? Vitamin D is a fat-soluble vitamin. Fat-soluble vitamins, so called because they are soluble in fats and oils, are absorbed in the intestines alongside fats from our diet and then stored in adipose tissue and the liver. Each of the four fat-soluble vitamins, A, D, E, and K, have unique and diverse functions in the body, playing integral roles in a range of bodily functions such as vision, bone homeostasis, immune function, and coagulation.
So there's two types of vitamin Ds, vitamin D2 and vitamin D3. And why are these so important? When they're activated, vitamin D plays several critical roles. One, vitamin D increases the absorption of calcium and phosphate from the diet. These minerals are essential for building and maintaining strong bones and teeth. 2. Active vitamin D works directly on bone cells. It supports the activity of osteoblasts and osteoclasts, which are responsible for building and reshaping bone tissue. This ensures bones remain healthy and capable of repairing themselves. 3. Vitamin D helps regulate the levels of calcium and phosphate in the body and in the blood by working with hormones like parathyroid hormones, and these hormonal partnership helps maintain proper mineral balance and prevents excessive loss or buildup. So where do you get vitamin Ds? Humans can get vitamin Ds from sunlight, diet, and supplements. Specifically, vitamin D2, you can get them through plant sources such as mushroom. And vitamin D3 you can get from the sun and animal sources such as fatty fish, egg yolk.
Now let's look at vitamin D toxicity, also known as hypervitaminosis D, which is what happens when you have too much vitamin D in your body. But first, how much is too much? The Endocrine Society's clinical practice guidelines state that the recommended dietary intake for adults from 19 to 50 years of age, as well as from 50 to 70 years of age, is at least 600 international units per day, while those above 70 years of age should consume at least 800 international units per day. However, the maximum suggested intake or upper limit is 4,000 international units per day for everyone above 8 years old. It's worth noting, though, that this number is for those without vitamin D deficiency. Those who are deficient in vitamin D will have a higher upper limit determined by their doctor so as to correct their deficiency. Also, most of the time, vitamin D toxicity only occurs when individuals consume over 10,000 units of vitamin D per day. Vitamin D toxicity is pretty rare and usually not caused by people consuming too much vitamin D through their diet. The most common ways of ingesting too much vitamin D are misusing over-the-counter supplements by taking excessive doses, or prescription errors coupled with a lack of frequent monitoring of vitamin D levels. Toxicity from lack of monitoring is most often seen in patients who require high doses to treat conditions like osteoporosis, renal osteodystrophy, psoriasis, and more. Next, while the amount of vitamin D in foods is very rarely enough to cause toxicity, if you are taking high doses via supplements and are also consuming high amounts of foods that have been fortified with vitamin D, you are at an increased risk of toxicity. As you can see, this box of Cheerios cereal claims to now have 2 times the vitamin D content it once had. 1,25-dihydroxyvitamin D, also known as calcitriol, is the biologically active form of vitamin D. Certain illnesses, such as granulomatous diseases and lymphomas, can also cause vitamin D toxicity through excessive production of this molecule. So what actually happens when there's too much vitamin D? Why is too much vitamin D toxic? We mentioned earlier that vitamin D is important for calcium absorption and bone remodeling. When you have a lot of vitamin D, you get a lot of vitamin D metabolites. Those metabolites increase calcium absorption in the intestines, as well as calcium mobilization or release from our bones. This leads to hypercalcemia, which is when there's too much calcium in the blood. Hypercalcemia causes a number of consequences, which are thus the typical symptoms of vitamin D toxicity. Increased calcium release from the bones leaves them weak, causing muscle weakness, bone pain, and fatigue. Neurological symptoms are more severe and can include confusion. Gastrointestinal symptoms are also likely, as are kidney symptoms like polyuria, which is excessive urine production, polydipsia, which is excessive thirst, and the formation of kidney stones. When hypercalcemia is severe, it can cause cardiac arrhythmias as well. Next, there are a number of medications that may interact with vitamin D, as you can see here. If you are taking any of these medications, please consult your healthcare provider before starting any vitamin D supplements. Vitamin D may interfere with the effectiveness of some of these medications, and some of these medications may cause hypercalcemia or affect how the body uses vitamin D. In either case, it may be risky to have high vitamin D levels while on these medications.
Now we'll be focusing on one of the clinical trials on vitamin D toxicity. The researchers looked at individuals with elevated levels of a form of vitamin D, 25-hydroxyvitamin D. As you can see, the graph here is written in US standards, nanograms per milliliters. I have converted the graph into nanomoles per liter, the Canadian standard. The researchers focused more on patients with levels above 299.5 nanomoles per liter, which is considered potentially toxic. So there was a total of 73,779 patients, and out of these, only 89 patients, 0.12%, had levels above 299.5 nanomoles per liter, indicating a rare occurrence of significantly elevated vitamin D levels. So despite the elevated levels, only 4 patients showed symptoms of vitamin D toxicity. The ones I highlighted in red, the black bars, are the symptomatic individuals, and there were only 4 individuals with those. So this indicates that symptomatic vitamin D toxicity is quite uncommon, and these individuals experience issues such as weight loss, abdominal pain, weakness, and confusion. One individual with severe symptoms experienced renal failure, poor balance, and slurred speech. 2 of these cases involved children who received incorrect doses of liquid vitamin D supplements due to confusing of dosing instructions. So the study highlighted that many cases of elevated vitamin D were linked to high-dose supplements, particularly the liquid formulations. And these formulations pose high risks of overdose, especially in children, due to dosing errors. Now that we talked about vitamin D toxicity, how do we actually treat this? So the first line treatment is to stop taking vitamin D and rehydration with fluids. Doctors will often give an IV fluid with salty water, isotonic saline solution to fix dehydration and help the kidneys flush out extra calcium. There's also therapy with glucocorticoids, which help lower calcium levels by reducing how much calcium the body absorbs from food and increasing the amount the body gets rid of through urination. There's also anti-resortive therapy with the use of calcitonin, biphosphonates, or both. In some severe cases, where the problem comes from the bones releasing too much calcium, medications such as calcitonin and biphosphonates are used. Now these are the second-line treatments. These are used when the basic treatments don't work well enough, or in rare medical situations, doctors might use these. First one is phenobarbital, which helps liver break down vitamin D faster. There's ketoconazole, which blocks vitamin D production, but it can also block other important functions, so it's used very carefully. There's aminocholines, which are medications like chloroquine that reduce vitamin D activity. There's CYP27B1 inhibitors, which are the newer drugs being developed to directly block the body's production of active vitamin D without messing with other body processes. There's rifampin, which is an antibiotic that also helps the liver break down vitamin D through a different pathway. So how do you actually prevent vitamin D toxicity? Don't take more than 4,000 units IU a day of vitamin D unless your doctor tells you to. Avoid high-dose supplements unless they're prescribed, and get your vitamin D levels checked if you're taking supplements for long term. If you have health conditions that affect vitamin D levels, follow your doctor's advice carefully. Remember, more isn't always better, even with something as healthy as vitamin D.
But wait, can other fat-soluble vitamins cause toxicity as well? The answer is yes, although it's quite uncommon and almost always from excessive use of supplements. For vitamin A, the upper limit for adults is 9,000 international units per day, although one would need to consume a lot more to trigger toxicity. For acute toxicity, one needs to consume over 300,000 units of vitamin A, while for chronic toxicity, prolonged intake of over 25,000 units per day is required. Toxicity from this vitamin can result in many symptoms, but ultimately results in kidney and liver damage as the main complications. Vitamin E toxicity is similarly rare. The upper limit in this case is 1,500 international units per day if consuming the natural form of vitamin E, and 1,100 units if it's in its synthetic form. High doses of this vitamin can increase risk of hemorrhages and interfere with blood clotting. Lastly, vitamin K has no known toxicity associated with high doses in adults, so there's no official upper limit. However, vitamin K intake should not be excessive and ideally obtained from a healthy, balanced diet of green leafy vegetables rather than from supplements.
We hope that this video helped you understand more about vitamin D and vitamin D toxicity. Remember, this video is only for informational purposes and it does not substitute professional medical advice. Always consult with your healthcare provider for personalized medical advice. Make sure to enjoy your week and stay healthy.